Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Welcome to the JOMA podcast. I'm your host, Jenny Berkovich, board certified pediatrician and director of education for JOMA. If you don't know what a gastro-psychologist is, this is the episode for you. My guest today is Dr. Esther Stein, a graduate of Rutgers University holding a doctorate in psychology with specialization in gastro-psychology. She received advanced training at Mount Sinai's Inflammatory Bowel Disease Center and GI Motility Center. She has delivered lectures for the Crohn's and Colitis Foundation and has conducted significant research on the mental health of young adults with IBD. Dr. Stein's work bridges the gap between gastrointestinal health and psychological well-being for patients with IBD, IBS, reflux, gastroparesis, visceral hypersensitivity, and other gastrointestinal disorders. I hope you enjoy this episode as much as I did.
Hi, Esther. Welcome.
Hi, nice to meet you.
I'm so thrilled to have you come on and talk about the amazing work that you're doing. I think it's so fascinating. One of the very, I think, newer and more recognized concepts is the connection between our mood and our behavior and the psychological aspects of how we go through life and the gastrointestinal manifestations of that. So I want to hear first a little bit about how you started out in the field that you work in.
Oh, absolutely. So it's kind of interesting. I kind of wish there was a more dramatic twist to it, but it sort of fell into my lap. When I was an undergrad in Brooklyn College, I was in a psychology honors program and I had to do a research thesis. So the only lab that was open was a lab that was working on inflammatory bowel disease. And they were actually affiliated with Mount Sinai. They were doing a project that was based out of Mount Sinai. And we met, every so often at the IBD Center in Mount Sinai. And at one of our meetings, they always look different, but at one of our meetings, the gastro-psychologist who ran a lot of the related services at the clinic. So besides for, the physicians who are there, there was also a nutrition program, a psychology program, social work, and pharmacy. And she struck me, I don't know, she left a lasting impression. And then, fast forward a few years later, I was in graduate school at Rutgers and in a psychology program, a doctoral psychology program. And I reached, I had done my practicums, I was up to externship, and I knew I wanted to tap into health psychology. But I wasn't actually in a health psychology program. And I was speaking to my externship director at the time. And I said, I had this crazy idea. I remember this one woman from a long time ago. What's if I can work with her? That would be, a great opportunity. And he was like, oh, well, let's call her. So I called her and landed up with her. She is one of the most brilliant, wise pioneers in the field. Her name is Dr. Lori Kiefer. She mentored me for 2 years. And at the time I worked in the Mount Sinai IBD Center, then also in the Mount Sinai GI Motility Center. The GI Motility Center really works with people with reflux, nausea, dyspepsia, which is stomach pain or bloating, and IBS. And so I really got a nice background. And I thought, as I was there and I've been meeting so many Jewish patients, Orthodox, all different types and stripes, and it's so, prevalent in our communities, I thought it would make such a difference to bring it back to our community. So to be trained very well where I am and then bring it back to our communities where, most people aren't aware of these services. Most people aren't aware of the field altogether. It's a relatively new field. And so I kind of, wanted to make this my career and to really bring this to the community.
That's a pretty cool story. I think it's powerful, even if it doesn't have a dramatic discovery to it. A lot of times, especially when I'm taking care of patients with any gastrointestinal issue, and the question comes up with like, how is mental health even connected to it? I usually give kind of like a generic answer. Well, we have serotonin, which is a hormone that circulates in our related to our nervous system in our brain, right? And it's also very commonly found in the GI tract, and same serotonin. And I kind of leave it at that. It's obviously much more complex. Can you give it like a general overview of how these like mental health and gastrointestinal health, which are seemingly super, super disconnected, are in fact very related?
Absolutely. It's a very good question. I think it's hard to explain, on one foot. But the way I like to explain it, initially when I meet with different patients is I like to refer to the gut-brain axis, and that's the communication network between the brain and the gut. So, our brain and our gut are very connected through this axis, and that's where all the communication happens. And this communication is bidirectional. So we have our central nervous system, which is our brain, communicating with our enteric nervous system, which is our gut. And there are different, influencers, drivers, reinforcers that really can arouse the central nervous system and sort of dysregulate the communication with the gut, right? So, for example, when we talk about, I have knots, I have butterflies in my stomach, or my stomach is in knots, right? When we're anxious or when we're stressed, it doesn't come from nowhere. Right? We do sometimes feel our emotions in our gut, and that has very much to do with the communication between the brain and the gut. Now, stress is one of those, big influencers to our gut, right? It kind of arouses our central nervous system to release hormones like cortisol or other neurotransmitters, and that can alter gut motility, right? So we sometimes have inflammation. It can affect digestion. We might get symptoms like bloating or diarrhea or constipation. And, many people with IBS or IBD kind of, when they're stressed out, feel their symptoms worsen during that time. So when this communication is faulty, that's when, people might experience heightened sensations of pain also, which we call visceral hypersensitivity, which we might get to a little bit later. And really what a gastropsychologist does at these points is really to help modify the arousal response, to improve the coping, the stress management, really teach stress management skills, self-regulation skills, so that the symptoms can be better managed, and for patients with IBD, remission can be maintained. And so really that stress management piece is integral to the brain gut connection.
I think that was really clear. Thank you. I think it's important to point out that you're not suggesting that stress, anxiety, and disorders of mental health necessarily cause GI disorders, and vice versa, right? You're just saying that because of this axis, the two are very close related, and there's a lot of what we call comorbid conditions, right, that come out of right, somebody with inflammatory bowel or IBS or dyspepsia, right, very likely to also have a mental health component to it as well.
Yes, absolutely. There's no, direct cause. We are seeing some research really indicating that patients who are experiencing more stress might, you can actually see higher rates of inflammation, higher risk of hospitalization. So I think that's really speaking to the effectiveness of gastropsychology and brain gut behavior therapies.
Are there misconceptions that are common to your field that you often find yourself clarifying?
So I'll start off by just very broadly differentiating between what IBD is and what IBS is, because I think that confusion sometimes gets in the way. So inflammatory bowel disease is really comprised of Crohn's disease and ulcerative colitis. Those are chronic conditions, and they're characterized by inflammation in the intestines. There's a little bit, there's a difference between Crohn's and ulcerative colitis, but it's not relevant for now. But there's Crohn's and colitis. When you do a colonoscopy, you're going to see inflammation in the intestines. We like to strive for mucosal healing. So when someone is diagnosed with IBD and they do a colonoscopy and there is no inflammation, that means that they are in remission. However, on the flip side, IBS is when a person is really experiencing all the symptoms of Crohn's or colitis. So pain in the abdomen, constipation or diarrhea, irregular bowel movements, all the different, bloody stool, all these different kind of symptoms. But if you do a scope, there's actually no inflammation. So there's no physiological component to IBS. Now, it used to be thought that it's in the head, and doctors used to brush off IBS. IBS is part of a GI motility disorder. But what we're seeing actually is that people can experience symptoms without inflammation. So I'm going to take away that myth of it's not in the head. Those symptoms are real. And there's all different kinds of techniques to really help with those symptoms. Most of the goal of treatment with IBS is to manage symptoms, versus with IBD, it's to heal mucosal healing. So that's the difference there. Now, stress can, for people with IBD, stress can trigger inflammation. With IBS, there is no inflammation, but stress can actually start up symptoms. So, we spoke about the brain-gut connection a little bit earlier, but I think what's important also to talk about is the GI stress cycle. And that really highlights the interaction of stress and the gut, which is communicated through the brain-gut axis, right? So when a person experiences stress, their brain triggers the release of hormones like cortisol or adrenaline that activates that fight or flight response. And that could lead to changes in GI function. So, altered gut motility, people might have irregular bowel movements. They could be more sensitive to pain or discomfort. Like I said, that's visceral hypersensitivity. And then on the flip side, the gut can experience symptoms of like pain or bloating or irregular bowel movements. And that starts the anxiety or stress. Oh, I'm starting to feel a little bit of pain. What's if I'm going to have to be stuck in the bathroom the whole day? What's if I can't go to my meeting? What's if I can't go to work? I won't make the train, right? I'm going to need the bathroom, all of that stress. And that sort of starts that cycle where you're getting stress, release of hormones, higher perception of symptoms or pain. And that's really where a gastro-psychologist will come in and use the brain-gut behavior therapies, modify the arousal, and, really alter that communication. So I don't know if that kind of answers the myths about whether stress actually causes inflammation, but it definitely is an influencer, that's for sure.
That makes a lot of sense. I'm curious if we know yet what predisposes somebody to manifest their symptoms of stress through GI symptoms. So for example, right, you can have two people experiencing the same stressors, same amount of stress, but one person is going to actually have symptoms of IBS or visceral hypersensitivity or dyspepsia, and one person is not. Do we know what predisposes somebody to be more prone to experiencing GI distress as a result of like life stressors?
I mean, it's hard to know, but I think someone who in general is, has IBS running through the family, or IBD for that matter, they're probably at a higher rate of experiencing symptoms in the gut. I think in general, we all feel our stress a little bit differently. Some people feel it, in different parts of the body. Some people get migraines. Some people have, other sort of pains like in the shoulders or anything like that. But for many people, we feel it in our guts. And if you think about it, our digestive system really takes up a large part of our entire physiological, our bodies. So it's not surprising that many people might feel it in their gut.
That makes sense. So I'm dying to ask about prevention, but I feel like that would be skipping a huge step. So before we talk about prevention, tell me about some of the approaches and like treatment modalities that you've had success with.
So typically brain-gut behavior therapies, really their goal is to, like I said, modify arousal and stress to build self-confidence and build resilience. And we do that through cognitive behavioral therapy. And we also do that through gut-directed hypnotherapy. And I know that sounds like a new phenomenon for many people. I will say I was skeptical at first. I'm not alternative medicine, holistic kind of thinker, but I've seen such fantastic results with it. And I will say it's extremely important that we tailor the treatments to the right presenting problem. So gut-directed hypnotherapy is not for everyone. We generally use this for people with visceral hypersensitivity. And again, what the purpose of gut-directed hypnotherapy, again, like the term is, it's very gut-directed. So when someone is in a very relaxed state, their mind is much more open to suggestion. I'll explain what visceral hypersensitivity is so that you understand why gut-directed hypnotherapy works for it. Visceral hypersensitivity is really when there's an increased sensitivity to sensations. So people will develop like a heightened awareness or anticipation of pain or discomfort, and that could lead to chronic anxiety or somatization, which is in and of itself an anxiety disorder. And so what happens with visceral hypersensitivity is that patients really misinterpret their normal body responses as severe or abnormal. So for example, someone with heart palpitations, right? Sometimes our heart races a little bit more when we're nervous or when we're on an adrenaline rush. And for someone with visceral hypersensitivity, they'll start to think that they're having a heart attack. Or I like to use this metaphor of, responding to a fire drill as if it were a real fire all the time. When in reality, it's a fire drill, right? So we tend to be a little bit more relaxed. And so you'll see different kind of behaviors like very frequent doctor's appointments or constant worry about health. And that just reinforces that psychological distress and anxiety. And so what gut-directed hypnotherapy does is really to modify the arousal. So we do that when someone is in a very relaxed state. We give them some suggestions. Again, I'll give you an example. For someone who constantly feels pain in their gut and that pain is just so distressing and they can't do anything because the pain is so great, right? We might make a suggestion. And again, this is when someone is very relaxed. So we've walked them through an entire body relaxation. We sort of, we counted down to 20 to sort of get them into a hypnotic state. And then we'll make the suggestions like for this gut pain perception, right? Sensations that maybe used to be uncomfortable now increasingly feel just mild and soothing. They don't bother you anymore. And this is like a 30-minute hypnosis script. And then through the gut-directed hypnosis, we also, provide some cognitive behavioral suggestions to decatastrophize so that the arousal is not so heightened. So we, again, modifying that arousal.
That sounds like a really intense, like visit, therapy session, effort. I'm assuming it's not a one-time sort of experience,
No,
right?
this
Like this is like a tremendous amount of work.
Yeah, gut-directed hypnotherapy, we usually span it across 7 weeks,
Wow.
give or take, a little bit less, a little bit more. But again, that's really through a gastro-psychologist. There's all these apps like Nerva for IBS and those, they're coined as hypnotherapy, but really they're to do hypnotherapy, you need to be trained in hypnotherapy. And again, you don't want to let someone who might revisit some trauma to, drive home after, right? So when people use the apps, it's really a more deeper relaxation exercise versus a hypnotherapy. So I think it's important to recognize the difference. But again, these are all different self-management behaviors. So I'm very for anyone who's able to self-manage however they can with these conditions, by all means, they should do that.
I love that. So I guess we have to ask about prevention, because it's a big focus here on the podcast. Always, I love to ask about prevention.
Yeah.
Also, I get the sense that there's a lot that we can do, right, to kind of like get ahead of the power of our minds and to get ahead of the effect that it has on our gut. What are some effective therapies that you have found in terms of preventing, letting our minds and our moods affect our GI tract?
That's a good question. I think when it comes to gastro-related care, most people don't really tend to seek out care until they're really suffering, right? I think when our bowel movement patterns are, they're not something we pay attention to when things run smoothly. And then when they don't, we sort of let them spiral out of control before we actually bring it up to a doctor. It's very isolating. Most people don't talk about their bowel movements. It's not, it's not a topic of conversation. And that's what makes gastro conditions so isolating. You don't see it on the outside. What should be a normal bowel movement or a normal bathroom visit can sometimes, be so abnormal that people don't understand, right? When I tell you that my stomach is hurting, you might, for the general public, that might seem like you just got a tummy ache, but that could really mean a severe, really intense pain. So So in terms of preventative care, I think it's really hard to figure out, again, most people don't engage in preventative care until they're really struggling. But what research has, research has made a lot of advancements in this field. And I think what's so important, or what's really come about, is this holistic model, where we have most academic hospitals, they have IBD homes. And what that is that on top of physicians, we also have the gastro-psychology care embedded, nutritional care embedded. And the idea is that when a patient comes to an IBD center, they're really getting all of these aspects of care given to them at the same time, right? So we're not waiting for, no one's got to run around everywhere. When patients have this biopsychosocial model, or this holistic approach to care, we're seeing a lot better patient outcomes. And I think so, in terms of preventative care, I think, first of all, being able to make sure that we have all of these services in place. Most general gastro-psychology practitioners do not have these services in place. So just the awareness of it, right? That's important. Also, I think it's important to have a good social network, right? Again, like I said, it's very isolating. We don't tend to talk about these things, but when we have the support of family or friends or someone who we can talk to about these symptoms to see what's normal and what's not is as important. And a good patient-provider relationship, also very important, especially for IBD. When we're dealing with a chronic illness, you want to be able to come to your doctor with any symptoms that seem to be irregular. You want to be able to talk about different treatment approaches before it gets too late. You want to be able to, communicate your lifestyle, right? And especially as Jewish patients or religious patients, we have Shabbos, we have Yom Tov, we have a whole different diet, right? So we want to be able to communicate these things to our doctors. And when that relationship is good, I think that it certainly impacts patient outcomes too. Again, not so much on the preventative care, but even starting out, just to know what you should have in place, when you're first experiencing symptoms, you're first going for your visit, for your assessment, for your diagnoses.
I think that's very clear, and I think helpful from thinking about chronic conditions, inflammatory bowel, etc. Are there any preventative strategies or things that you've seen in the literature of preventative things for maybe avoiding the development of IBS or dyspepsia, things that have more of a somatic component?
Stress management is certainly one of them, right? And that can be in different, that can happen in different ways. Sometimes it's more mindfulness based, right? So like for visceral hypersensitivity or even dyspepsia, we'll tend to use the gut-directed hypnotherapy. And so as preventative or even early on, we might want to engage in different mindfulness-based exercises. That would be something. I think also for those with anxiety about, using the bathroom for a long time, even for children or school-aged kids, right? Needing to go to school, but having to use the bathroom initially, right? Needing extra time on tests, all those school-based accommodations. I think it's very hard to think of this when you're going through the symptoms, but as a gastropsychologist, I'm very much for, I very much, and this is again in line with Dr. Kiefer, my mentor, her line of thinking is really resilience-based model. So we really try to push our patients to do whatever they can at best, because otherwise we kind of fall into this learned helplessness, right? There's no reason for a student to need more time on tests if they're cognitively or academically doing okay. We might want to stop the clock, right? That might be something, right? So that you can use the bathroom, but we really need to educate everyone around our patients so that we can understand what it is that they're experiencing. Just more of a resilience-based approach of like, if I'm deciding between, should I go out, I'm starting to feel a little bit pain, should I go out with friends? I have we have a date tonight with friends, or should I stay home, right? I like to, tell my patients, well, how about we pack like an emergency bag and go out with friends, right? So, to go home if you need to, take extra stuff, extra clothing if you need to, in case of an accident or anything like that, or even to cut it short or stay close to home, right? Maybe make different accommodations or different strategies or changes to your plans, but not avoid, right? We don't want to avoid, because that'll kind of fall into this learned helplessness pattern.
I like that. I want to go back to something you said earlier. You mentioned diet and how, right, in our life we have very unique diet. Holidays overwhelmingly have like, right, certain foods associated with them. How does diet play into this whole approach? Is it a big part of therapy for people who have, you know, GI conditions and mental health things going on?
I think diet is an essential part to gastrointestinal care. Again, it has everything to do with our digestive system. I do think, however, that it's so important to go to to see a trained registered dietitian who has background in the field, because not only do dietitians know, can give you recommendations for nutritional value or different foods that are, that you can eat, or different diet models or methods. They also have the physiological component of the gastrointestinal disease, right? So for example, in IBD, it's really important that a dietitian know the location of the inflammation, because in different parts of the intestine, wherever it might be, that'll mean a whole different diet for somebody. So, I'm going to leave it to the dietitians to really speak to that element of gastrointestinal health. But I do think, again, very important for patients to seek out the appropriate care. A lot of people, again, I don't want to call out anyone, but we have a lot out there, a lot of health coaches, a lot of different, a lot of articles. My goal is that patients should be good consumers of research, right? And so to understand what's out there and what makes sense. Just because one method works for somebody doesn't necessarily mean it might work for someone else. So again, I wish it was more out there, meaning that there were more registered dietitians who practice GI health, and it was more readily available, but it's not. And so people have to make that decision of, what to do for their health. I think it's important to see somebody versus to just read up on it and decide for yourself.
I want to end by asking what you kind of see for the future of the field. Are there any advances or like upcoming things that you're really excited about in the field of gastropsychology, especially in terms of inflammatory bowel, improving patient outcomes, things that are really going to enhance people's lives?
You know what? Actually, yes, I think multidisciplinary care is certainly the gold standard for caring for IBD. So right now, it's not so common to have gastropsychological care embedded into regular routine IBD care. It's really in only those academic centers or academic hospitals. I think that's changing, and we're going to see much more multidisciplinary approaches. So we're going to see gastropsychologists, embedded in most gastropsychology practices. Hopefully, we're going to train more gastropsychologists in this area. And maybe it'll translate to other chronic illnesses also, right? Where we have other forms of care included in the, aside for the medical care. And that's going to be a huge game changer.
I think that's great. That's probably applicable, by the way, to like so many things, right? And disorders and fields, but certainly one that has so much multidisciplinary potential, right, already built into it.
Yes.
I absolutely feel and would agree that there's probably going to be significant improvements in the way that we think about disease, and how our mental health is really connected to so much more than just what it appears on the surface. I want to end with one final question, which is something that I ask or try to ask all of my guests. If, again, primarily from a preventative health standpoint, but you can answer this however feels right. If there was one thing that you could share with people, or one thing that you like find yourself telling patients over and over, that people can do now, if let's say they don't necessarily have any GI associated issues, but any lifestyle changes, diet changes, etc., things that you really wish people could know and do ahead of time in order to prevent problems developing later on in life. Does that exist?
I'm not sure, to be honest. I'm not sure if that exists. I would say, again, I don't know that I in my head that I term it as preventative. I just think, having the proper supports at the right time is important. So, for anyone to prevent further escalation, I think it's important to surround yourself with a good support network, around yourself with a good care team. I think also, engaging in healthy lifestyle choices, right? Doing exercise, eating a more balanced or, healthy diet, really having good stress management skills in your back pocket or in your toolkit, I think is important, right? Those are really the preventative. Those are really the things that I can think of that are preventative, or at least helpful, right? That can sort of build resilience so that we have that in the event that things do spiral a little bit out of control.
Excellent. I love that. Esther, I want to thank you so much. Thanks for your time sharing
Absolutely,
the
sure.
amazing field that you work in. And thanks for the beautiful work that you're doing to help all kinds of patients.
Thank you. Thank you for having me here. It's important that we share this with everyone, right? So we gain a lot more awareness for the whole community.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.